everybody. My name is Christine Esposito, and today I'd like to speak to you about multiple sclerosis, or better known as MS. I'd like you to imagine for a moment that you're walking along and all of a sudden you feel yourself stumbling, or you're reading a book and the words become blurry. Even if you can make out the words in the book, you just don't quite understand what they mean. These are just a few things that those living with multiple sclerosis deal with at any given time. Multiple sclerosis is a disease of the central nervous system that affects over 400,000 Americans. I am just one of those 400,000 living with multiple sclerosis each day. Multiple sclerosis is a chronic disease that attacks the central nervous system. The central nervous system is made up of the brain, the spinal cord, and our optic nerves. Symptoms of multiple sclerosis could be mild, such as tingling or numbness, or they can become quite severe, such as complete paralysis and loss of vision. The symptoms of multiple sclerosis are unpredictable and they can vary from person to person. We need to understand how our brain works to understand a little bit more about multiple sclerosis. The brain consists of billions of cells. Signals travel from cell to cell along axons. Let's think about an electrical wire. Axons function much like electrical wiring, and like an electrical wire, axons have a protective covering, which is known as myelin. To maintain the integrity and speed of the electrical signal, myelin must be intact. If we damage an electrical wire, it will short circuit. In multiple sclerosis, the immune system attacks the brain cells and creates scarring along the myelin sheath. These areas of scarring are also called sclerosis or lesions. The lesions disrupt the transmission of messages that travel through our brain. In other words, the brain short circuits just like that electrical wire, and then our symptoms are present. There's many symptoms of multiple sclerosis. To name a few, we would have double vision, blurred vision, or even diminished vision where colors don't quite look right. Soon, muscle fatigue, pain, numbness, stiffness, or pins and needles can develop. As the disease progresses over time, patients may lose coordination and endure symptoms such as tremors, dizziness, slurred speech, which you'll find sometimes I do as I'm speaking, and trouble swallowing, in addition to emotional disturbances such as depression and anxiety due to the disease process. Besides the visible physical symptoms of multiple sclerosis, there are hidden symptoms like fatigue and cognitive impairment that can impact the lives of those with MS and their families. In 2008, I was diagnosed with multiple sclerosis, but looking back, I've probably had symptoms of the disease since 1996. Initially, my symptoms were dizziness, electrical shock-like feelings in my head. I had squeezing chest pain, numbness in my leg, and a lot of testing was done to make sure it wasn't cardiac related. I was sent to see a neurologist, and I had an MRI done, and that was back in 1996, and the MRI at that time showed no lesions. I went back to work, the symptoms disappeared, and I didn't give it a second thought. Then in 2005, while working as a nurse, I experienced stroke-like symptoms. I would get a zapping feeling in my head, numbness in my legs and hands, and I lost the ability to speak for a few minutes. My fatigue also became much more disabling at that time. Once again, went back to the neurologist and had another MRI. This time the MRI showed lesions in several areas of my brain. I also underwent many other testing such as blood work, CAT scans, a spinal tap to rule out other diseases. None of these testing are conclusive for MS, and they also do not rule out MS, but they do rule out Lyme's disease and syphilis. I still had no diagnosis, so I left my job for a few months because I believed it was the mold in the building that I was working in that was making me ill. My symptoms subsided with rest. I returned to work as a nurse again in a fast-paced medical practice, and life was moving along smoothly. Suddenly I began having symptoms once again: numbness, difficulty forming words, worsening fatigue, along with other things. This led to my final diagnosis of MS. The episodes that I experienced were relapses or exacerbations. And as you can see, multiple sclerosis is not always quick to be diagnosed, and people can go many years without a true diagnosis. The severity and the rate of progression determine which type of MS a person is diagnosed with. Right now, I'm diagnosed with relapse and remitting MS, and I do have some remissions, but a lot of my symptoms have not completely gone away. There are 4 different types of multiple sclerosis: relapsing remitting, primary progressive, secondary progressive, and progressive relapsing. Relapsing remitting, which I have, we experience clearly defined attacks and worsening of neurologic symptoms and function. These attacks are called relapses, flare-ups, exacerbations, whatever you want to call them, they're no fun. The second type of MS that we hear of is primary progressive MS. This disease course is characterized by slowly worsening neurologic function from the beginning with no distinct relapses or remissions. Approximately 10% of the people diagnosed with MS have this type. Secondary progressive MS. Following an initial period of relapsing remitting MS, many people develop a secondary progressive disease course in which the disease worsens or more steadily, in which the disease worsens more steadily without occasional flare-ups or recoveries. Approximately 50% of people with relapsing remitting develop this type of MS. The last kind that we hear of is progressive relapsing. In this rare course of MS, 5% of people experience steadily worsening decline. With no clear attacks, they may experience some recovery following a relapse, but the disease continues to progress without remission. Sometimes these people will end up on feeding tubes because of their inability to swallow. They are usually doing urinary catheters because they can't control their urine, and they have many problems. Men are more likely to be diagnosed with the progressive relapsing MS. Although there are different stages and levels, testing and thorough examinations are necessary for a diagnosis. This leads me into how multiple sclerosis is diagnosed. We touched on that a little bit, but I'd like to go further. At this time, there's no symptoms, physical findings, or laboratory tests that can alone determine if a person has multiple sclerosis. The doctor has to use several strategies to determine if the person meets the criteria. It's very important for the doctors and for a patient to be very clear on their symptoms and keep a log over the years to track relapses and flare-ups. Other strategies include an MRI, Evoke Potentials, and spinal taps. In many cases, the person's medical history and neurologic exam alone provide enough evidence to meet the diagnostic criteria, but not always. Before we had advanced imaging technology, doctors would put a patient into a hot tub to see how their muscles reacted to the heat. Those with MS don't do well in the heat, and it usually makes the symptoms worse. If you're in the heat for too long, you can get blurred vision, become dizzy, find yourself stumbling or stuttering more. I know I, for one, cannot be in the heat, and when I am, I use an ice vest. And it's a vest that I fill the pockets with little ice packs that you would put in a lunchbox, and it keeps my body temperature down. The MRI is the best imaging technology for detecting the presence of MS plaques. And I'm going to show you later on an image of my MRI with the plaques or lesions that are circled, so you can get a better idea of what they look like. Although the MRI is a very useful tool, a normal MRI of the brain or spinal cord does not rule out MS. About 5% of the people who have MS do not initially have brain lesions on their MRI. Once again, you can see how difficult of a disease this can be to diagnose. Another test is Evoke Potentials. These are tests that record the nervous system's electrical response to the stimulation of specific sensory pathways. For example, you sit in front of a screen and they flash the lights at you, or little bricks, and the test picks up how long it's taking for your brain to process what you're seeing, or for your optic nerves, for that matter, to process what you're seeing. when our myelin sheath is damaged and there's scarring, it slows down these responses. Cerebrospinal fluid analysis, the dreaded spinal tap. This is one test that I had, and mine was negative for the O bands that they're looking for. It detects system proteins that we usually have that our immune system makes, and usually the proteins or the O bands are found in 90 to 95% of the people with MS. But like I said, mine was negative, so I was one of those 5%. But I was also not having an attack at the time I did the spinal tap. It did rule out that I didn't have Lyme's disease. I didn't have syphilis, so that was good news. There are no blood tests for multiple sclerosis. Blood tests can rule out other conditions just like the spinal tap, including Lyme's disease or collagen vascular diseases, and it can also rule out AIDS, and someone with AIDS or HIV can also present with neurologic symptoms. So it is important to have all the blood work and other tests done to make sure that there's not something very serious going on. Not that MS isn't serious enough. There's no cure for multiple sclerosis, but effective strategies are available to help modify the disease course and to treat the flare-ups and manage the ongoing symptoms that patients deal with on a day-to-day basis. Several medications that are available, what they hope to do is to slow down the disease process. There's only a 30% chance that the medications will stop or slow down. It's not going to completely stop, but they're trying to prevent frequent relapses. Some of the medications that they have available, the patient self-injects. They are Avonox, Betaseron, Copaxone, and Rebif. And they're injected either daily or every other day, and I believe Avonox is once a week. When a person has a flare-up of their symptoms or they go into an exacerbation, the doctors will treat with an IV course of steroids. This is a high-dose steroid. It's usually given at between 1,000 grams and 1,500 grams a day for 3 to 5 days. These steroids, they can have many side effects as well, such as bone deterioration, and of course they create anxiety and can cause weight gain. But it does help to take the inflammation down, and hopefully the patient will regain some of the function that they may have lost during this flare-up. While there are many symptoms that are present daily, even when a person's not in a flare-up or having a relapse, such as dizziness, fatigue, urinary disturbances, and depression, the symptoms are there daily. They can be relieved by medications. One medication that they use for the fatigue is called Provigil, and that is usually used with someone for narcolepsy and also for shift work disorder. But they are finding that it does help those with MS maintain a level of energy to make it through the day. I'm yet to start on that medication. Right now I can't even make a full day of work because of the fatigue. Also, they give baclofen for muscle spasms, and for the bladder issues they might use something like Ditropan. Some patients, once again, they do have to self-cap for their urinary problems. There's a lot of information on MS, much more that can be given in the short time that I have to do this speech. And I'm sure that you can see what a complex, life-altering disease this is. 400,000 people in the U.S. currently have multiple sclerosis, and with 200 people being diagnosed each week, those numbers are rapidly growing. It's my hope that with the information given to you today, that you will have a better understanding of this disease, and it is also my hope that no one in this room ever has to hear the words, "I'm sorry, you have MS." Now that this is ending, I would really like to show you the slides of what the brain looks like when it has lesions. And once again, I thank you for listening today. I know it was a lot of information. And if you have any questions, you can please feel free to email me. And the email will be up at the last power slide. Thank you. As I said earlier, I'd like to show you some slides of an MRI of the brain. Pictured here are 2 slides from my most recent MRI. The white spots within the black circles are lesions, also known as plaques, scarring, or sclerosis.
These areas interrupt the transmission of signals through the brain, causing symptoms of MS. Some of these symptoms may have been apparent during my speech, others were not quite so noticeable. Once again, I thank you for taking the time to learn more about MS. If you have any further questions, please feel free to contact me. Thank you.